Our guest is Dr. Alessandro Grattoni. He is the chairman of the Department of Nanomedicine at Houston Methodist Hospital. Doctor, welcome to the show.
Thank you for having me.
Well, it's awesome. First of all, this time of year, we always bring awareness to breast cancer here in Houston, National Breast Cancer Month. But let's tell people, first of all, what you do in your profession as a doctor, what type of work you're doing in this world.
Thank you for your question. So I'm serving as the department chair, Department of Nanomedicine. What we do at the Houston Methodist Hospital Research Institute is we are developing nanotechnologies for biomedical applications. So for the treatment of different diseases that ranges from diabetes all the way to cancer. Cancer is, of course, one of the area of major focus in our research developments. And we're putting a lot of efforts into this field. Nanotechnologies are commonly used in multiple different areas and fields, from the industry to energy to, of course, medicine. And medicine is one of the areas where nanotechnology can find a lot of application and a lot of useful use. And nanomedicine is nothing else than the field that combines all these different disciplines in science, ranges from chemistry and physics and also biology and medicine, of course, into one single unique discipline that leverages all the knowledge from the other fields to find solutions for patients that are affected for diseases. So this is what we're doing, and we're doing it on a daily basis, and this is our focus. And it's been a pleasure to work on different fields, but of course focusing on breast cancer with also the support of the Nancy Owens Breast Cancer Foundation.
As far as the applications for nanotechnology in the research and in the curing of breast cancer and treating breast cancer, how does that manifest itself for people to understand that?
The idea of using nanotechnology is simply that you have an opportunity with this novel technology that they are very intriguing for many people. You have an opportunity for designing materials and particles and drugs in a way that they are much more effective as compared to the conventional treatments, and that provides and that offers less adverse side effects to the treatment itself. So this is one of the key importance, as many individuals may have already heard. The key of nanotechnology is really targeting the tumors or targeting cancer and leaving all the healthy tissue untouched so that the patient doesn't suffer the adverse side effects. They are typical and very severe of chemotherapy or immunotherapeutic strategies. So this is what we're doing. We're taking these matters, we take molecules, we take different drugs, and we combine them, we engineer them to the point that we can use them in the best way possible, improving efficacy and reducing side effects.
And in the world of nanotechnology, I'm guessing in reading some things about you and what your research is doing, it also has a role as far as implantable devices or implantable treatments. Would that be correct?
Correct. This is absolutely correct. So nanotechnology not only involves nanoparticle and small little tiny objects, but also involves devices such as tiny implants that possess, for example, nanopores. Nanopores are nothing else than very small holes that we can use to control the release of therapeutics, for example, from an implant. So these very small size holes are in size, to give an idea to the people who are listening, that are about 20,000 times smaller than the width of our hair. So it's extremely small, but by doing so, by using these very small holes we achieve into membranes, we're able to control the release of molecules that they are in size close to these holes themselves. These allow us to deliver drugs for extended periods of time. For example, while inserted inside of a tumor mass, and deliver drugs inside of the tumor exclusively, so that the drug doesn't doesn't affect the rest of the body. So the rest of the body remains healthy and remains untouched by the drug, while at the same time, the drug is having the efficacy and providing a therapeutic effect against the tumor itself.
That is absolutely fascinating. I want to make sure I heard you correct. You're talking about 20,000 times smaller than the human hair?
That's correct. That's absolutely correct.
That is incredible.
Right. And implants that we use, the implants are small as well. They're obviously still visible in that case because these implants are about a third of the size of a grain of rice, so extremely small. And they mount these tiny little membranes with all these tiny little holes and allows for the release of drug inside of the tumor. Just to give a better understanding of what we're really working on is these very small implants are inserted inside of a tumor mass, for example, a primary tumor. They are inserted via a minimal invasive needle approach, similar to the way that clinicians perform biopsies. These devices can be inserted inside of the tumor. Once they are inserted inside of the tumor, they release their payload. They release the drug, which in our case is immunotherapeutics. And we use the tumor as an environment where we trigger the immune system of the person to recognize cancer and to fight it and to destroy it. The beauty of our approach is that we only need to treat one tumor mass, despite that maybe a patient may have metastases distributed around the body, because once we treat the primary tumor mass and we teach the immune system, our own immune system, how to recognize cancer, then the immune system, which is made out of cells, is able to go around the body and find the metastases that are distributed around in the other organs and destroy them as well. So we have a local approach where we just deliver the drugs locally where it's needed, but we have an effect that goes beyond the local tumor and it goes to the metastases. So our ultimate goal is really to provide a minimal invasive treatment with minimal side effects for which patient can actually benefit from the treatment, live a healthy life, while at the same time they are treated with their own, using and leveraging their own immune system.
You may have answered the question that many people have as far as research when people give certainly to and help further causes like breast cancer and any kind of disease or problems. We wonder as research dollars are put forth what progress is being made, but it sounds like what you're doing. I mean, how long has this nanotechnology for breast cancer specifically been around? It sounds like this is one of the manifestations of dollars that have been put forth to help this cause.
Well, I have to say that there is a huge number of great scientists that have been working hard for many, many years for the fight against breast cancer. And my laboratory is just one of these. So, of course, I want to give credit to all the scientists that are out there and working hard on this field. We have been working on this for about 13 years now. And we have made good progresses, and we are hoping to translate our technology from the bench side, so from the research level, to clinical use and clinical trial in the first place. This is very our objective. What I can say is that the funding that they are spent from the National Institute of Health, of the Department of Defense, or even from foundations such as the Nancy Owens Breast Cancer Foundation, have been spent very well, and a lot of progress has been made. Of course, this is a very difficult field, and a lot of research is still needed, but the progresses are substantial, and I think it's we need to give kudos to the scientific community as a whole and for their supporters for the incredible developments that have been occurring in the past few years.
We're talking with Dr. Alessandro Grattoni. He is the chairman of the Department of Nanomedicine at Houston Methodist, right here in our fourth largest city. Doctor, before we close out this segment, what else would you like people to know about what you're doing?
Well, I would like to say that in fact, with respect of our work, we have benefited from the support of the Nancy Owens Breast Cancer Foundation. They have been so great in supporting our research as well as the research of other laboratory at MD Anderson and at Baylor College of Medicine. I have been having the pleasure to work with them and collaborate with them closely and understand clearly what is the need of patients that are affected by breast cancer. So we are very delighted to work with them and receive their support. What people can do to support their cause is providing them with funding support, and donation, of course. They will all go to the good cause of research against breast cancer. One important thing is, of course, for taking technologies from the bench side all the way to clinic, it requires a lot of financial resources. And those resources cannot come alone from a foundation such as the Nancy Owens Breast Cancer Foundation. However, the funding that the foundation provides are what is required for scientists to gather all the preliminary data and the results so that they can apply for larger amount of funding from the National Institute of Health, the National Cancer Institute, the Department of Defense. And I just wanted to conclude saying that we did exactly what I just said. We leveraged the funding received from the Nancy Owens Breast Cancer Foundation, and we were able to succeed in putting together a proposal to achieve funding from the Department of Defense, which were about $2.5 million funding for the next 3 years of research and development. So I think that there is a lot that can be done with the support from the Nancy Owens Breast Cancer Foundation, and I'm very grateful once again for their support.
And of course, their website for donations is nancyowens.org. That's nancyowens.org. And by the way, Doctor, I encourage people to go to HoustonMethodist.org and look at your accomplishments and more about your work. I'm just seeing here so many things. It looks like you're holding patents too as far as apparatuses of delivery methods and so many things. You're in a fascinating field doing tremendous work, and my hat's off to you, sir.
Thank you so much. And if anybody wants to know more about what we're doing, we also are present on social media pages on Facebook and Instagram, as well as on Twitter. And people can follow us at Grattoni Lab. That is our name on the social media.
And that's Grattoni, Dr. Alessandro Grattoni. Thank you so much for being on the show.
Thank you very much.